Here is a prediction. It might feel like science fiction, but it is not. By the year 2025, which is right now, a significant number of Americans will receive a medical diagnosis without ever speaking to a human doctor first. The initial analysis, the first look at what ails you, will come from a machine. It will come from an artificial intelligence. This is not a distant future. This is not a dream. It is the new reality of healthcare taking shape around us. The algorithms are already here. They are learning. This change is as profound as the invention of the microscope. It will reveal a universe of health we could never see before. We are building a telescope for the body. Picture a day in the very near future. Perhaps it is today, August 31st, 2025. You wake up with a persistent cough. You wake up with a slight fever. In the past, this meant a choice. Wait it out, book an appointment, or go to urgent care. Today the process is different. You open an app on your phone. A friendly AI chatbot asks, "How are you feeling?" "I have a cough. It's dry. I feel tired." The AI listens and processes. It asks clarifying questions just as a human doctor would. It might ask you to use your phone's camera. Please point the camera at your throat. It might read your smartwatch for heart rate and blood oxygen. Each piece of data is another star in the constellation of your health. It runs through thousands of potential diagnoses in the blink of an eye and presents a clear summary. Based on your symptoms, there is a 92% probability you have influenza B. How does an AI actually see disease? It does not have eyes, it does not have intuition, it has data, and the power to process that data on a cosmic scale. A scan that is a grayscale puzzle to a human is a vast numerical matrix to an AI. It sees texture and pattern, tiny clusters of pixels that signal disease. It can detect patterns with precision that can surpass the human eye. But AI does more than read pictures. It reads your whole record as one dataset. It cross-references blood tests, prescriptions, and trends that no single visit would reveal. It is a detective that never forgets a clue. It can incorporate genetic code, wearables, environment, and population data to craft a precise health map. Not just what is wrong now, but where your health is headed. The result is a deeply personalized assessment, a roadmap for prevention, early detection, and treatment tailored to your life. One of the most profound benefits of AI in diagnosis is speed. For conditions like stroke, every minute can determine outcome. An AI can analyze a brain scan in seconds, identifying clot versus bleed so clinicians can act immediately. This information helps doctors make life-saving choices faster, across specialties. A mole can be photographed and rapidly risk-scored by an AI trained on hundreds of thousands of images. Patients get faster answers and act earlier. AI is an unblinking safety net, checking prescriptions, flagging abnormal labs, catching what busy humans might miss. That relentless precision reduces errors and makes healthcare safer for everyone. Speed and precision paired with human judgment means earlier treatment, better outcomes, and more lives saved. As we venture into AI-driven healthcare, what is the role of the human doctor? Is this empathetic figure destined to become obsolete? The answer is no. Their role is evolving. The AI is a tool. The doctor is the interpreter. AI tells us what the data suggests. The human handles the so what. Think of AI as the navigator on a starship. The doctor is the captain. The AI provides the map. The doctor helps you choose the path that fits your life. AI can automate paperwork and workflows, freeing clinicians to listen, think, and care. This is the promise, technology that restores the human heart of medicine. The future is not a machine or a human, it is a partnership that amplifies our capacity to heal. With any great new power comes great responsibility. The universe of AI healthcare is filled with promise and dark matter, privacy, security, trust. Your health data is your biological signature, genetics, past illnesses, mental health, daily habits. As we feed this data into AI, it must be protected with the highest security. In the wrong hands, it can be used to discriminate, exploit, or harm. Who owns your health data? You, your hospital, or the tech company? Clear laws must define ownership and control. We must build digital fortresses, encryption, robust protocols, and oversight. We must also eliminate bias by training on diverse representative datasets. Finally, trust is earned. Systems must explain their reasoning, show their work, and demonstrate consistent positive outcomes. Handing pieces of our judgment to non-human intelligence forces hard questions about accountability. If an AI makes a mistake, who is responsible? The doctor, the hospital, the programmers, or the vendor? An AI might predict future illness. Is that a gift or a burden? It could empower healthy changes, or create lifelong anxiety, insurance issues, or stigma. There is a risk of a two-tiered healthcare system where advanced AI is available only to the wealthy. But the promise is democratization. Expert knowledge at scale for underserved communities. We must program a clear ethical compass into these systems. The code must serve our conscience, always pointing toward the dignity and well-being of the patient. Let's look at a real example: ophthalmology and diabetic retinopathy. An AI trained on over 100,000 retinal images learned to spot tiny hemorrhages and microaneurysms. A technician can take a photo, upload it, and within seconds the AI says, "Refer to a specialist." This screens tens of thousands who would otherwise go unscreened. And it saves sight. In oncology, AI reads the literature, matches tumor genetics to treatments, and ranks options by evidence. It helps doctors make more informed, personalized decisions. AI places expert-level diagnostics into small clinics far from major centers. From ophthalmology to oncology, AI acts as a tireless screening filter, letting human experts focus on the patients who need them most. We stand at a precipice. 2025 is not the end, it is the beginning of a great voyage. Integrating AI into healthcare is a cosmic shift in how we relate to our bodies. The future will be predictive, personalized, and participatory. Your phone becomes a diagnostic tool. Your health data tells a continuous story. You become a co-pilot of your medical journey, partnered with human doctors and AI assistants. But we must navigate privacy, bias, and accountability with wisdom and foresight. Used well, this technology will help Americans live longer, healthier lives and bring expert care to every community. AI is our new starship, a tool to explore the universe within us. The goal is not the most efficient system, but the most caring and effective one. The age of AI medicine is here.